back to the Scalpel series, and today is the 10th episode of Scalpel series, and it's going to be really interesting. And we all know, today I'm going to talk about the most important organ of the body, that is heart. Heart is something that we cannot take a chance with. Heart, if something little bit goes wrong, patak, it will stop and we are no more. Okay, so that's the reason it's a very important organ, and there are a lot of correlation between obesity and heart diseases. So today we have our guest Dr. Harun. He is a cardiothoracic surgeon. Thank you, Dr. Harun, so much for joining us today, and I'm sure it's going to be very interesting. And see, you all know that for all the heart problems, okay, there are three major things that are responsible. One thing is genetics, which you cannot do anything about it. You have to just accept whatever genes you have got and you have to just take care. So genetics I am not going to discuss today. The second thing important is stress. Stress is something that is both personalized, it is all about our nature, and everybody has to handle stress, especially now with so much of more of mental work for everybody, less of physical work. So stress is going to be there, and we should know we have to learn to handle the stress. So that's the second thing. And the third most important thing is obesity. Obesity is directly related to the heart problems. Whether obesity, because of obesity you will have blood pressure, diabetes, metabolic syndrome, heart diseases. So everything is linked, and obesity is something that is reversible. The first two things, nothing much you can do about that, but obesity definitely it is something that is reversible, and we can do something to come back to the normal weight, and we can decrease the risk factors on the heart. So now the most important question I want to ask you, Dr. Harun, is how obesity is related to the heart diseases.
Yeah, first of all, thank you for giving me this opportunity to share
Honor
this
for us.
session. Yeah, actually, as we all know that obesity is not like it's like a social disorder. It's more of like it's a metabolic disorder, which is a very serious condition. So, like it affects any other parts of the body, like thyroid or endocrine system and other parts of the organs. So everything it affects. It affects the heart as well. So, which is a more important thing in recent years, because we all know that we are aware of that, like many heart diseases which are related to obesity gives a serious problems, and it's like an evolving problem in the many parts of the world, including developing countries and developed countries. So
now,
how obesity affects the heart? That means, see, obesity, it's give like a lot of metabolic changes occurs in the heart. So we all know that like in general it's a fat deposition. So obesity means it's a fat deposition everywhere it's in the body. It deposits in the heart as well as in the blood vessels also. So earlier we thought as like it was like fat storage disorder. So obesity and ischemic heart disease is a fat storage disorder. But recent years, so they found it's more of a chronic inflammatory response. A lot of chronic inflammatory response happens in the heart and blood vessels. So when the fat deposits occurs in the blood vessels, actually a lot of immune responses happens. So it releases a lot of inflammatory cells. And
this is a very, very valid thing that you have told, because I keep on telling the audience, obesity, okay, is an inflammatory disorder.
Exactly.
Because of obesity, there is so much of inflammation.
Correct.
And that inflammation only is responsible for all the diseases in the body.
Correct, ma'am, exactly. Because once the inflammation occurs, normally our body reacts to the inflammation. So it releases a lot of inflammatory cells and calciums, like so many cells deposits releases. So when the injury happens, the inner layer of the blood vessels, so everything gets accumulated there. It becomes organized mass or organized clot that affects the blood flow to the heart. This is the main important factor that affects the heart. Okay, this is the main relation to the coronary artery disease. And obesity, apart from coronary artery disease, there are other structural heart diseases also which happen, which is related to the hemodynamic changes when the patient becomes obese. Their body mass index increases, their demand will increase. Based on the increased demands, the structural heart also changes accordingly to the increased demand. And then some of the all like coronary artery disease and structural disease, once it affects the heart, the intrinsic part of the heart, that is the electrical system of the heart also it alters. So that in turn it turns into a like rhythm changes, that is like a heart rate or a heart rhythm changes occurs. That leads to cardiac arrhythmia, which is called it's a deadly reason.
So you
for
feel obesity is related to cardiac arrhythmias also?
As well, yes.
Right.
Correct.
So obesity gives coronary artery disease, then obesity is related with all the cardiac arrhythmias and everything.
Yes.
What else?
Then what else? Structural heart disease also. That there is something called the new thing called obesity induced cardiomyopathy, which will come later in this session, and that also occurs. And then everything.
So do you feel like sometimes when we talk to the layman in a normal language, like do you feel that when you are 60 kg and heart is used to one particular pumping to send blood to all the organs, especially brain till the legs.
Correct.
Okay. So do you feel that from 60 when you go down to 120 kg, the pressure on the heart also is more?
Exactly.
Right, the pressure on the heart is more, it has to pump more vigorously.
Correct. So it has to meet the demand of
yes.
the, because when the patient becomes obese, the body volume increases. Based on the increased volume, the heart has to pump more to the increased body volume. So ultimately the blood volume increases, the overall blood volume increases to the body. So that in return it comes to the heart. So then in the heart gets more volume than the usual average 60 kg man.
So that work for the heart also is more.
Yes, the
So
workload will be very
in normal language we can tell that heart will exhaust faster.
Yes, exactly. So heart is nothing like a muscle only, it's made up of muscle only. So like normal people we go to gym. So if you put on weight, if you do over workload, the muscle gets hypertrophic. Ultimately it affects that. When you do overwork, it affects. It gets affected by the work.
Okay, now because you told gym, okay, recent past, like last 2 years, we have seen a lot of people, they die during workout.
Correct.
Okay, they do intense workout. I have seen people dying during running marathons. Then I have seen people dying in the gyms, and so do you feel that what is the reason, why all of a sudden a person will die while gymming?
Valid pushing for the present condition in the society, because many people think that young age dying of heart attack and this thing, it's because mostly it is related to the cardiac arrhythmic issue. So there is something called the rate and rhythm of the heart which is going abnormal. That is called a ventricular. We used to call it as a ventricular fibrillation. That is the most common reason to get into sudden arrest when they are young. So what happens in young age? Normally, this sudden heart attack, sudden cardiac death occurs in an older adult actually.
Yes.
So especially when they are athlete. So when the profession is athlete, they normally they overwork and because their metabolism increases when they run and this thing. So the heartbeat gets faster each and every time. So at one point of time, the heart muscles gets thickened because of the overworkload. So when it becomes thick, it alters the electrical impulses inside the heart. That leads to a heart rate rhythm disturbances. That leads to arrhythmia and sudden cardiac arrest can happen.
So what is your message to the audience? People feel that he was so fit, he was going to the gym, still he died. So I understand that you should know your limits. You should not go beyond a certain limit, and you should not overstretch yourself and give too much of load to the heart also.
Correct.
So what is your message to the audience? Like how normal people can avoid this? This is something that we have been hearing so much of last 2 years. So I would like to ask him how to avoid all these things.
Generally, it is very difficult in a population screen everybody that going for any active sports event or active exercise and all these things. So we should there are two reasons. One is because of the excessive physical activity, and the other is something called genetic condition, which is inherited one. We cannot do anything for that. So in these physical activities, increased physical activity, like usually in the community, like in the sports authority, they should whoever they select the candidate for this excessive activity event, they should screen the patient, like not patient, they screen the person to go to whether they are in a high risk. They periodically assess the person, like evaluate the person whether they are going to any kind of these things. So there are a lot of recent studies they started actually. So people doing ECG and other electrocardiogram to look for any event, anything which is triggering the event to prevent, to notify or to identify the arrhythmic event during their session. So that thing can it's on. They started already evaluating all these things, but practically it is little difficult. So it's more or less in general you have to restrict yourself to certain extent that you should not over stretch yourself.
Yeah.
So that is the main idea. So because it's a human body is made up of certain good quality of this thing. You cannot stretch the thing. It will not work out. So ultimately something harm will happen.
The same thing, recently I was just seeing a patient just now, and they were asking me like, can I lift weights? I told you should yes, at any age you can lift weights, but if you are used to lifting 2 kg, then please lift only 2 kgs. Okay, after 45, 50, you should not overstrain yourself, then you will tear some muscle, you will get some hernia, you will get some other problem. So whatever you are used to, you do. All of a sudden you start, putting 30 kgs and 40 kgs, 100% you will have some issues.
Always it's good to have some guidance or prior attempting any kind of physical activity.
So I want you to tell the audience, like, what is the normal age group after which you should start doing routine health checks for the heart especially?
Earlier it was thought to be after 40 years or 50 years we should go for regular cardiac checkup or muscular checkup, whatever is there. But in recent years it's better those who have a significant high risk category, like strong family history or strong anything like previous event in childhood or anything. They should start screening their health checkup little earlier, at the age of 30 or 35.
So this is a very important message for everybody. After 30 or 35 years, at least you should start doing, because I am seeing a lot of people, even at the age of 50 years, who have never got even one ECG or an echo done, and then all of a sudden you find that their ejection fraction is 30% and some cardiomyopathy and things like that. So friends, today it was I am coming further some questions, but I am just telling the gist of the whole thing. Yes, if you are obese, you have high chances of high triglycerides and fat deposits in the coronary arteries, as he told, and obesity is an inflammatory disorder. It can give rise to blood pressure and diabetes, metabolic syndrome. So again, those people also will be at high risk for the heart disease. So especially people who are about 25 BMI, please start working out and start having control about at least weight loss options, to have a healthy heart.
There is one more thing. There are a lot of studies they have shown that increase in 10 kg of body weight, that increases in risk of developing coronary artery disease with 12%. Imagine that when a person gains 10 kg of weight, 12% increase in risk of developing coronary artery disease.
It's a big thing.
Yes, it's a big thing. Yes, it's a big thing. So that is where obesity is a very serious issue.
Yeah. So now see, there are a lot of data telling that if you lose 10% of body weight, if you are a diabetic, your HbA1c drops by 1%. So is there any data telling that if you lose 10% of body weight, your risk of heart diseases will come down?
Exactly. Likewise, so if you gain 10% or 10 kg of weight, the risk of increasing disease is 12%. Likewise,
this is something that is very important.
Yes.
Like once you lose weight, your chances of
reducing risk of developing heart disease, it will come down 100%. The chance of this thing will come down drastically.
So this is something that is very important. Then one another important question I want to ask you is, we see sudden deaths
Yes.
in the youngsters. This is not related to workouts or this thing. All of a sudden somebody dies during sleep, and we see sudden death sometimes. And even MI, like sudden chest pain, and before they reach the hospital they are dropped dead, especially the youngsters. So what can be the reason for this?
This reason is mainly of genetic reason. Most often this is related to genetic only. That is inherited, strong family history, like father, grandfather, those who have a very strong family history, and of course the sedentary lifestyle habits and all these things related to sudden massive heart attack.
So for people who have a family history, I think they should start screening their heart, as you told, by 30 years of age.
Correct, exactly.
Right,
That
and
is
at least,
correct.
yes.
So see, at one side the obesity and the lifestyle changes, everything happens. On the other side, it goes to the hereditary, like inherited genetic issues with this.
So that is also equally important.
Equally important. That we cannot change anything, but we should be aware of that. So those who have like the father and grandfather, they have like heart disease even earlier, they should be little more cautious than what they are doing, how their lifestyle is. So accordingly, they should change the lifestyle. So in obesity, which is in our hand, so we can always modify and reduce the risk of developing heart disease.
Because nowadays we are seeing heart diseases are on an increase, and in US, if you see, it has increased enormously, because even the obesity rates are very high there. 1 in 5, each 5 people will be obese.
Yes.
Okay. So now slowly in our country, also in urban areas, obesity is as high as 38%.
Yeah, that is what they did. The World Health Organization says that nearly 39% of world population, they are overweight. Of these, 13% they are actually obese, which is a very significant
It's
number.
a big number.
Yeah, very significant
It's a big
number in
number.
the society.
So I think it's high time we need to start doing some awareness programs, especially for the heart, and with so much of youngsters dying. And another important thing I want to know is, there is something called obesity cardiomyopathy. Like obesity related cardiomyopathy. For friends, for you people to know what is cardiomyopathy. Cardiomyopathy is, it is some injury to the heart where heart just dilates and it is not able to pump adequately. Okay, so it's a failing heart basically. Okay, that is called cardiomyopathy. So there is something called obesity cardiomyopathy, and we see a lot of obese patients who are really, with BMI of about 45-50. Sometimes we do pick up cardiomyopathy in those patients. So what is the reason for that, and whether it is reversible or what can be done?
Correct. So obesity induced cardiomyopathy. There are cardiomyopathy for several reasons. Genetic itself has a reason to develop cardiomyopathy, but which is a very new thing. Of late we found that there are so many patients, as you told, related to obesity, they develop cardiomyopathy a little later in life. That means those who have a severe chronic obesity, we can say that for 10 decades or 1 decade or 2 decades, like 10 years or 20 years of chronic obesity, usually the cardiomyopathy found in this group of people. Because what happens, it alters the hemodynamic changes inside the heart to get into that cardiomyopathy level. So what happens, as we discussed earlier, the heart demand, the body increase the demand will happen. So obviously the heart blood, the whole blood volume increases. That it comes into the heart. The heart has to pump all the volume to meet that demand which is required for the whole body. So what happens initially, when the heart is fresh, when the heart is healthy, it pumps. So after over a period of time, what happens? It keep on pumping means it gets some amount of fatigueness. So what happens when the fatigueness happens? The entire volume which is coming into the heart, it's coming regularly. So the heart has to dilate. So the heart will get dilates, and eventually it fails to pump. So and then the terminal event happens, which is failure of the heart happens. That is called, the condition is called dilated cardiomyopathy. In general, it is called as a failed heart. Like as you said, failed heart, it dilates the heart. So for this thing, which is a very critical disease, for that, once it develops that extent, we cannot do anything unless like you have to go for the transplantation. That's it.
So this is something that is very important, because I often see patients when they tell me, "Madam, it's okay, I'm 120 kg, but I'm okay, I don't have any problem." But they do not realize that
Correct.
what
The long
is
term, yes,
the long-term implications they are not able to realize, because okay, now you don't have any problem, you are blessed.
Correct.
But then later, the amount of pressure that will be built up on heart and
Correct.
all the organs, I feel.
Many people think
So they feel that it's okay. I'm obese, but I'm okay. Nowadays you get clothes for all sizes, double XL, triple XL, 4XL. It is something that is normal now in our country also. In US though, it is absolutely normal. Like you get clothes
Yes.
of any size.
Exactly,
Okay.
correct.
So people are just not bothered. They do not even feel that here. From medium to L you go, then you start thinking, oh my god, L has come, and from that XL means you have to do something.
Yes,
You cannot keep yourself to XL. Okay,
Correct.
so that is what is the message that I am trying to tell people is start coming down with your size. Obesity is really dangerous, and today you have seen what all obesity can give rise to, whether it is a cardiomyopathy or it is blood pressure or coronary artery disease, certain things what we were discussing is sudden cardiac arrest or sudden MI in young people. If it is related to genetics, we cannot do anything, but that does not mean that you don't try to be fit. Even if you, in fact, if you have genetic factors and all the way more, you should be very careful. At least this is something that is avoidable. Okay. So it was very interesting today, and I think it was a good lesson for everybody to understand that what all obesity gives problems to the heart. It was very well explained, and would you like to tell anything else to the audience?
Yeah, that in general, the obesity is a reversible condition. As we all know that. So since it leads to a lot of so many important critical events in our life, we should always take serious considerations about obesity to rectify all these things, to prevent all these things basically.
So do you feel that regular exercise is important?
Of course, regular exercise is important because
what do you feel as a as a cardiothoracic surgeon? You are seeing so much of heart issues and you operate so much daily. So what do you feel? What is the normal basic requirement?
So in regular before getting heart disease, to prevent getting heart disease, so regular 30 minutes walk a day is more than sufficient. So for regular 5 days a week itself is enough for to reduce the risk of heart disease.
So this is for normal people, guys. Because my people, I tell them 1 hour, nothing less than 1 hour.
No, I'm telling the minimum thing.
Yeah. So this is for normal people. Like if you are really having a healthy lifestyle and you are normal weight and everything is normal, then yes, at least 30 minutes of walk on a daily basis, 5 days a week is a recommended thing. But if you want to lose weight and things like that, please increase it to 1 hour. And walk should be a brisk walk. It should not be like just like that relaxed walk and you are talking. And generally I tell people don't talk when you are walking, because if you are really having a you are walking fast, you will be breathless if you start talking. So we always tell, so that is what is 30 minutes of walk. Okay. So friends, we'll end the session today, and it was really nice today, Dr. Harun. Thank you so much. And friends, please take care of the heart. And I feel exercise is a tribute to heart. So please start exercising and take care of your heart. Thank you so much for watching this session.
Thank you.
Thank you.